Probably the question we most frequently get asked is, how do you treat spider veins or thread veins successfully? At the back of this is the fact that a lot of people do not have good experiences of having their spider veins or thread veins treated. Patients frequently come to me and they've been to laser clinics, they may even have had injection sclerotherapy, and it hasn't worked out very well. The other reason why it's an important question is because people are very concerned about these. Surgeons are often operating on varicose veins because they want to prevent the patient going on to develop skin changes and ulcers in their 80s. But actually the patients who see me aren't looking that far forward. They're looking towards their next son holiday or their son's wedding, and they don't want to have thread veins on their legs or spider veins. I would say there's 3 steps necessary to treat spider veins or thread veins successfully. The first step is to establish whether the problem is just spider veins and thread veins, or whether there are serious underlying varicose veins associated with the thread veins or spider veins. And that's done by first and foremost examining the patient. If it becomes apparent that the only problem here is thread veins, then you can cut straight to successful treatment. The second step is only necessary if you have a serious suspicion that there are underlying varicose veins present. In that case, the patient should have a proper ultrasound or duplex examination in a good vascular lab by a good vascular technologist. And what that will do is will show that the problem is either just thread veins, or it will show that the problem is major venous incompetence causing pressure coming down the leg, which is causing the thread veins to blow out. Now, in the first situation, you'll get a great result from injections or laser treatment. In the second situation, then you will need to treat the pressure coming down, because it makes sense that if there's pressure coming down the leg and you inject that vein, then the vein beside it is just going to blow up and come out. And that's actually why your varicose vein treatments are not treating most patients with venous flares or thread veins very successfully. So, step 2, if you need it, get an ultrasound. And that brings us on to step 3. Once we've established that the patient has thread veins and thread veins alone, then go straight ahead to treat them with sclerotherapy. Now, the choices there are between injection sclerotherapy and laser sclerotherapy. I would suggest that injection sclerotherapy in over 90% of cases is the most effective treatment. It's the quickest, it's the most complete, and it gives the best cosmetic results. Laser sclerotherapy certainly has a place, but it's a very minor place for very tiny varicose veins. But ultimately, I suppose the message I want to give is that with careful selection, you will get a good result of with treatment of your minor varicose veins. You will get back into a mini skirt, you will get back into shorts, you will look good at your son's wedding, you will look good on the son holiday.